we've been talking about it, and you have been tracking this variant very closely for a while. So what does this new research tell you about our body's ability to fight it?
No one's tracking anything more than Mike's tracking Elsa right now. But you're right. We are tracking the Delta variant. And I think what this new study, it's a study out of France. And basically, the good news is that the vaccines are protecting against hospitalization. We're hearing that time and time again. But what the study showed was 100 people that were infected with the virus. Okay, and then people who were vaccinated with the Pfizer vaccine and the AstraZeneca vaccine. And what they showed is that our antibodies, this was a lab study, so the antibodies didn't protect as much against the Delta variant as they did against the Alpha variant, which was the original one in the UK. Right. And then what they showed is that one dose of the Pfizer vaccine and the AstraZeneca vaccine only neutralized about 10% of the patient's samples, okay? So you needed 2 doses to boost that number from 10% to 95%. So after 2 doses, there was excellent neutralization, which means stopping of the virus. Once again, what are we saying? With the messenger RNA vaccines, make sure you get that second dose.
All right, well, Dr. Ellen, do you think that the Delta variant increases the chances we will be wearing face masks again this fall?
Right, so that's an important question. So Shana, here's the issue. Remember, the CDC right now is recommending that any unvaccinated person wear face masks while indoors, okay? I don't think that's going to change in the fall. So that's the first thing. The second thing is we have to remember, what's the new normal going to be for mask wearing? There's going to be a part of our population that feels more comfortable wearing masks, whether they're unvaccinated or vaccinated, not just to reduce their risk of COVID-19, but also some of the other respiratory viruses. Remember, this past winter, we had a historic low number of flu cases because people were wearing masks. Now, do I think that the CDC is going to change guidance to say vaccinated people need to wear masks indoors? I think only if we start seeing a real surge in cases, hospitalizations, deaths from the Delta virus. If we don't see that, then I don't think that guidance will change.
Because the whole world is involved in this, Dr. T. We're learning from each part of the world. And there's a new study from the UK that suggests that the symptoms from COVID may be changing with the virus, and whether you've been vaccinated or not could make a difference. So what can you expand about that? What can you tell us about that?
This was interesting. It's an observational study. What it basically showed is if you're unvaccinated, you know what the symptoms are: fevers, cough, headache, sore throat, really flu-like symptoms, okay? But if you get 1 or 2 doses of vaccine, it actually turns what's really can be a significant flu into more of a common cold. So headache, runny nose, sneezing, sore throat. And guess what? I think one of the most interesting parts of the study was that these symptoms were much less severe, they were less in number, and they lasted for a smaller or shorter duration. So these vaccines, remember, once you're vaccinated, you have less virus, even if you're infected, and it lasts a shorter period of time, so you're less likely to spread to other people.
Right.